Every Thursday, we take a look at a health issue or concern affecting many people. We break down the information for you and tell you what you need to know to keep you healthy. In this morning's Ask a Doctor, Dr. Kalani Brady from the John A. Burns School of Medicine joins us with everything you need to know about the variants of COVID-19. Good morning, Dr. Brady.
Good morning.
Okay, so when we say that phrase, for those who don't know, what does it mean when we're talking about variants of COVID?
A virus has certain characteristics where mutation can occur. So a virus isn't always the same. In the flu shot, we try and predict the variants that is occurring with the flu every year. And COVID-19 also has mutations and variants. And we've discovered, of course, some especially powerful strains of COVID virus around the world.
And have any of these now, because we have heard, can you talk about the ones that have reached Hawaii?
Sure. There is one from the UK, United Kingdom, and one originating in South Africa, which have hit Hawaii. And there is no evidence that these particular mutations are more serious than what we have with COVID already, which is great news.
Okay, and how concerned should we be? I mean, is there a different way to protect against these other variants, or is it just kind of, it's a bummer that these are more contagious, but still do the same things, wear masks, wash your hands? How can we protect from these particular variants?
Good question, Kelly. We don't need to change a thing, which is frustrating for those of us who have had a year of prevention of COVID. So wearing a mask on a regular basis whenever you go out of the house, washing the hands for at least 20 to 30 seconds when you are exposed to outside forces, using hand sanitizers on a regular basis, maintaining a 6-foot distance, and avoiding congregating in crowds. These are the same things we would do for the variants that we have discovered.
Okay, and moving forward now with, folks getting their vaccinations, is this going to be protecting against all of the different variants? Are there maybe variants that we don't know about yet that wouldn't possibly be the case?
Well, there are no doubt variances that we don't know about yet. The mutation of the virus is a dynamic thing, so it continues even while time is moving forward. The vaccine thus far seems to protect against the variants that we have out in the public, and there is very little mutation in Hawaii thus far. The vaccine works, but remember, our primary prevention is not the vaccine, it's the social mores that we have recommended.
Exactly. All right. Thanks so much, Dr. Brady, for joining us this morning and breaking this down for us. And again, that newest strain from South Africa just recorded in the United States for the first time in South Carolina, 2 new cases, which will likely be spreading. So we'll continue, of course, to track that. But as he said, it's still the same way to protect yourself. So do keep wearing your mask, social distance, wash your hands, and keep safe out there. Thanks so much, Dr. Brady, for breaking that down for us.
You're welcome.